Yeah, that's a very important question when we think about how policymakers might be able to use our information to produce better policies. And there's our information, I think, is providing a lot of help to support policymakers think about where to put resources. So as I mentioned earlier, um, we have opportunities to think about prevention. We have opportunities to think about treatment, and we have opportunities to think about care models and where should these resources be allocated to best impact the largest population. So with nationally representative data, we can think about how it's impacting the whole population, but also groups of people. So for much better targeting of where we want to place our very scarce resources in this area. And when we think about value, and if we're able to put numbers around that value, that also provides information to further drug development and development of other interventions that will help individuals and the families and reduce the cost for society. So, what is the value of this? Where should we be focusing our dollars? Um, we can compare across early interventions in the disease stage versus later interventions. Well, they're probably both valuable. Which ones are more valuable? We need some numbers around those to be able to think about um, what's the relative value to where we intervene, along with what do we intervene on. You bring up a very important point, which is the caregivers, which sometimes get missed in this discussion. The hours that they provide is often part of the discussion. It's not unknown that family and friends provide an enormous amount of care for persons with dementia. But we know a lot less about how it impacts other aspects of their lives, how it impacts their work, how work then impacts their household families, income, their ability to save for retirement. So, all of those other factors that are potentially impacting caregivers, how it impacts their healthcare use, their own healthcare use, their own health. And so, with these data, we can provide um, a much better insight into all the impacts on the people that are affected by this disease. So dementia affects an individual with the disease, but it has these really large spillovers to the family members. And there's lots of opportunities to support caregivers that's currently not in our system. So we currently don't have much support for caregivers. We don't have long-term care insurance. Individuals pay mostly out of pocket for nursing home, any home health aides. Um, Only individuals who are eligible for Medicaid will have some covered services of home health aid and for nursing home. So for the um, broad majority of the population with dementia, their care is not covered. So there's opportunities to think about how we might better devise insurance against these long-term care costs that support persons with dementia, but also they're also their family members.